If you're a caregiver, you already know that mealtime can be, well, really stressful. So today, we're going to talk about dysphagia. That's the medical term for difficulty swallowing. And we're going to give you some really clear, practical strategies to make things safer and hopefully a little less stressful for everybody involved.
This quote from Daily Caring just hits the nail on the head, doesn't it? Mealtimes are supposed to be about connection and nourishment, but when every single bite feels like a risk, they can become filled with worry. Our goal today is to help you turn that anxiety into confidence.
And look, if you're dealing with this, please know you are so far from alone. Dysphagia affects about 1 in every 25 adults in the US each year. And that number, it gets even higher among seniors. Some studies actually show it affects up to 68% of people living in nursing homes. It's way more common than we think. So here's our game plan. We'll start with why this is such a big deal, really understanding the dangers. Then we'll walk through how to get a proper diagnosis, get a handle on the special dysphagia diet, go over some practical daily safety tips, and we'll wrap up by talking about the absolute importance of building your support team. Okay, let's dive right in. What exactly is dysphagia, and why does the seemingly simple act of swallowing suddenly require such careful, serious management? So, dysphagia, and it's pronounced dysphagia, is the official medical term for any kind of trouble with swallowing. It usually happens because the muscles in the mouth and throat have gotten weaker. This can just be a part of aging, or it can be a result of something like a stroke, dementia, or Parkinson's. The key thing to get is that it's not just a minor issue. It's a real medical condition with some very serious risks.
And this right here shows you the absolute core of the problem. On the left, you've got a normal swallow. You see? Everything goes right down the esophagus, the food pipe, to the stomach. But on the right, that's aspiration. That's when food or liquid, or even just saliva, goes down the wrong pipe, the airway, and ends up in the lungs. Aspiration is the main danger we are trying to prevent.
Now, what makes this even trickier is something called silent aspiration. This is when food or liquid goes into the lungs, but the body's alarm system, that normal coughing or gagging reflex, it doesn't go off. It can happen completely unnoticed, and you might not know anything is wrong until a serious complication like pneumonia suddenly develops. It's incredibly dangerous. Okay, so now that we get the risks, how do we start finding solutions? Well, it all begins with getting a proper diagnosis. You have to identify the problem before you can even begin to manage it safely.
So this is the big question for so many caregivers, right? You might notice little things here and there, but at what point does it become serious enough that you need to call in a professional?
These right here, these are the red flags to watch for. Of course, persistent coughing or choking is the most obvious one, but I really want you to listen for a wet or gurgly-sounding voice right after they take a drink. That can be a huge sign that liquid is just sitting on top of the vocal cords. And of course, things like recurring chest infections and losing weight without trying, those are major warnings that demand an immediate call to the doctor.
Generally, the process for getting a diagnosis looks something like this. You'll start with a speech-language pathologist, or an SLP. They are the absolute experts in swallowing disorders. They'll likely recommend something called a swallow study, where your loved one swallows a substance called barium that shows up on an X-ray. It's amazing, really. It lets the doctors watch in real time exactly what's happening inside the throat when they swallow. From there, they can give you a really precise diagnosis and treatment plan.
All right, so once you have that diagnosis, the main way you'll manage this at home is through the dysphagia diet. This is all about changing the texture of foods and liquids to make every swallow safer and to prevent that aspiration we talked about.
Now, to make sure this is done safely and consistently, healthcare professionals use what's called the IDDSI framework. It stands for the International Dysphagia Diet Standardization Initiative. It's basically a global system that standardizes food textures. This way, when a doctor prescribes, say, mildly thick liquids, it means the exact same thing in any hospital or care facility anywhere. It's all about safety.
And this table gives you a simplified peek at some of those levels. You can see level 0 is thin, just like regular water. As you go up, the thickness increases to make the liquid move more slowly and be easier to control. A professional, that SLP or doctor, will tell you the exact level of thickness for liquids and texture for foods that's safest for your loved one.
Now, this slide might have a few surprises for you. You'd think soft things like ice cream or Jello would be perfect, right? But the problem is, they melt in the mouth and turn back into a thin, hard-to-control liquid, which is really dangerous. And of course, things that are dry and crumbly or super sticky like peanut butter can also be a real problem.
On the flip side, it can be a real challenge to get enough calories when you're on a modified diet. So it's super important to focus on foods that are packed with nutrients and healthy fats. Think full-fat Greek yogurt, creamy avocado, pureed squash. These are things you can easily blend into dishes to boost calories and help maintain a healthy weight. Okay, let's get into the really practical day-to-day stuff. These are strategies you can start using at home today to make every single meal a little bit safer. This is really the question at the heart of it all, isn't it? It all comes down to creating habits in an environment that support a safe swallow every single time. These best practices are, frankly, non-negotiable. Sitting fully upright at a 90-degree angle lets gravity do the work of guiding food down the right way. And staying upright for about 30 minutes after eating helps prevent anything from coming back up. Now, you might be surprised to see avoid using straws, but straws can shoot liquid to the back of the throat too quickly, making it harder for weak muscles to manage. And finally, good oral hygiene is critical. It ensures that if a tiny bit of aspiration does happen, there are fewer bacteria going into the lungs with it. Giving medications can be a whole other challenge, but step number 1 here is the most important rule of all. Always talk to the pharmacist first. Some pills have special time-release coatings, and crushing them can be really dangerous. Your pharmacist is the expert who can tell you if a pill is safe to crush and mix with applesauce, or if there's a liquid version available that can be safely thickened.
And finally, let's talk about the most important resource you have. It's not a special spoon or a thickener. It's people. Managing dysphagia is a team sport, and it is so important to remember that you are not doing this alone.
Let's be honest for a second. Managing someone's health, especially with a condition as constant and stressful as dysphagia, can feel incredibly heavy. It is completely normal to feel the weight of that caregiver burden. It's okay to admit that it's overwhelming, and it is absolutely essential to get support for yourself, too.
This is your support network. You've got your professional team, your SLP, your doctor, your dietitian, but please don't underestimate the power of peer support. Finding an online dysphagia support group connects you with other people who are in the trenches, navigating the exact same daily challenges. They can be an amazing source of practical tips and just understanding.
So we'll end on this question. This is a journey, for sure. After hearing all this, what is one small, manageable first step you can take? Is it finally scheduling that appointment with an SLP? Is it looking up one of those support groups? Or maybe just calling the pharmacy to ask about your loved one's medications? Taking that first step, whatever it is the beginning of a safer, more confident chapter in your caregiving.